Hello, everyone, and welcome. My name is Megan Reed, and this is a module with some helpful tips to prepare you for and to help you make the most of your fieldwork and your clinical rotations experience. In the first half of the presentation, I will give you some tips to help you prepare for your fieldwork experience. And in the second half, I will give you tips to utilize during fieldwork to make the most of the experience. I will finish the presentation with some reminders and advice from students who recently finished their rotations. Finally, at the end, there is a link to a quick 3 to 5 minute survey about the module. I would greatly appreciate it if you would take just a few minutes to fill this out, as it will help me gather information on how to improve these modules, as well as my entire program, which I will talk about in just a few slides. So before we get into the information, I thought I'd tell you a little bit about myself. I'm a student at the University of St. Augustine for Health Sciences, located on the St. Augustine campus. However, I'm from Louisville, Kentucky. I am in my 8th term working on my doctorate of occupational therapy degree, and this is my last semester. So this semester I will spend working on developing, implementing, and evaluating the results of my project. And my doctoral project is called The Role of Occupational Therapy in Improving the Quality of Life and Academic Success of Graduate Students. As I said before, I will spend this semester working on my doctoral program. The main goal of this program is to improve the quality of life and academic success of all graduate students throughout their entire time at USA. First, in order to gain insight into the student's experience, faculty and staff at USA completed a survey and an optional interview about the difficulties students encounter and the current supports in place for those students. For those of you who may be wondering, faculty and staff were interviewed instead of the students themselves in order to ensure student privacy was protected. After analyzing the results of the survey and interviews, I selected the most common difficulties students encounter. Those difficulties, along with particularly stressful time periods such as practicals and midterms, as well as many others, will be addressed using modules, educational resources, and presentations which will be made available to students via the website. Finally, following the implementation of this program, I will write a proposal to USA to include OT as part of student services to increase the academic success and quality of life of all of its students. Before I get into the tips and strategies portion of this presentation, I want to highlight the importance of fieldwork or clinical rotations in your academic program. Research has shown that these fieldwork and clinical experiences allow students to integrate and apply the knowledge they have gained to real-life patients. This helps to facilitate the student's transition to an independent therapist. The fieldwork experience is also shown to result in improving clinical reasoning skills, which also improves the student's confidence. This improved reasoning and confidence will help you both when you sit for your boards and also when you are a practicing clinician. Fieldwork is also the ideal situation to assess a student's clinical abilities. While the assessment of your abilities may sound scary, it's not to determine all of the reasons why you shouldn't be a therapist, but instead how to make you the best therapist you can possibly be. So here are some of the tips and strategies I have for when you're preparing for your fieldwork experience. First, start early and fairly often communication with your supervisor. Think ahead when it comes to managing your housing and finances while on fieldwork. Ensure that you go to fieldwork adequately prepared. And finally, practice documentation ahead of time. So as far as preparing for fieldwork, this is the most obvious first step. Be sure to reach out to your supervisor as soon as you get the green light from your fieldwork coordinator. You want to communicate with them often, but don't flood their inbox with hundreds of emails. Make sure to send clear and concise emails asking all the questions you have. You can ask them some of the more practical questions, like if there's a dress code. Another great question to ask is if they have any housing recommendations, especially if you've never been to the city that you'll be doing your fieldwork in. You can ask them where past students have stayed, or if you've already chosen a house or apartment, you can ask them to confirm that it's in a good, safe area. Also, don't forget to ask about hours, what time you will be expected to be there, and what about a weekly schedule, as some acute hospitals or inpatient rehab settings may require you to work a few weekends. Finally, ask about the materials to review before coming to be prepared. What are some of the common assessments, interventions, and assistive technologies they use? And also ask about how they write goals. Do they use a COAST method or a SMART method? And another great question to ask is if documentation is electronic or written, and whatever else you can think of that may help you prepare. Now let's talk about getting your housing and finances in order. To be quite honest, this can be one of the more stressful parts of preparing for your fieldwork, but if you put in the time and do it right prior to fieldwork, you won't have to worry about it at all during your experience. First, let's talk about housing. I know that I and many of my classmates were actually able to find housing by joining Facebook subleasing groups in the cities we were placed. Other suggestions are to ask your fieldwork site where other students have lived, or see if any of your classmates have any connections in that city. Maybe they have relatives or college friends that live there. And finally, see if any of your fellow classmates will be nearby. You can search for housing together, as it will probably be cheaper that way. Now, for managing finances, some of my advice to you is consider all the additional expenses due to fieldwork when you're applying for your loan, such as extra housing, travel expenses, and food expenses. Also, as far as saving money, try to find a roommate and make yourself a budget and try and stick with it as best you can. My next piece of advice is to come well prepared, as this will help counteract one of the most common feelings students encounter during their first fieldwork, which is feelings of unpreparedness. So don't assume that you'll remember everything you learned in school. Take time to review it, and don't rely solely on the information you learned in class. Reach out to other sources like journals or podcasts, things like that. Before going to fieldwork, ask your CI if there's anything in particular you should review before your first day. Any assessments, interventions, assistive technology, and even if they say no, review the material anyways. This will help reinforce your learning and make sure that you're prepared. You'd rather be over-prepared than under-prepared in every situation, especially fieldwork. Be sure to review any class material that is applicable to your setting. And I would encourage you to bring those materials with you if you have to move for fieldwork, so they're still accessible even during your fieldwork experience. Something I did before my rotations was create a list of interventions targeting common deficits seen within the population that I was going to be working with. So, for example, for my pediatric rotation, I included a list of common interventions addressing fine motor skills and social skills, coordination, and handwriting. Also, review goniometry, MMT, transfers, and bed mobility. And keep in mind, it will be much more difficult with real patients than when you practice on your classmates. So the more practice and knowledge you have, the better off you will be. Finally, review common medical terms such as AMA, against medical advice, or S/P, which is status post. Another huge concern that fieldwork students have is with documentation. But there are a couple things you can do to ensure that you're well prepared. Most importantly, being practicing documentation itself. I encourage you to think about the way you would document how you and others around you do things. So if you're babysitting or helping your grandma do things around the house, think about how you would document those activities. You can also practice using videos. So you can go to YouTube and search for a video in the setting that you were placed in. You can also use the International Clinical Educators videos, or ICE videos, which are accessible to all USA students. And when you are practicing, be specific. Include all the activities that you see in the video, any assist levels, the frequency, all kinds of details. Also, another great practice is to think about how you would grade the interventions you're seeing in the videos. How would you make them easier and how would you make them harder? Another great way to prepare is to review past goals for any applicable class and practice writing similar goals. But I want to advise you to be flexible. Documentation will differ based off of your CI's preference, the setting, the population, everything. Documentation varies greatly. Even two clinics within the same setting treating the same population will have variations in how they document. And that's why it's important you don't get stuck in one mindset and remain flexible when it comes to documentation. So, the next couple of slides, I'll go into more details about strategies you can utilize during your fieldwork to make the most of the experience. These include openly communicating with your supervisor, planning ahead, staying positive and professional, taking time for yourself, managing your time well, and combating imposter syndrome. So, open communication with your supervisor may seem obvious, but I highlight it first because I would argue that it is the single most influential aspect of your entire fieldwork experience. A study found that communication was identified as the most essential professional skill for fieldwork students, but also the most lacking professional skill as well. Another study interviewing fieldwork students found that feedback, especially positive and face to face feedback, was considered valuable to their fieldwork experience and their professional growth. In order to communicate effectively and create an environment in which feedback can be given honestly, create a relationship in which you both feel comfortable being honest with each other. Remember that any constructive criticism your supervisor may give you is to make you a better therapist, so don't get defensive. Honest and open communication will allow for the opportunity to discuss any expectations they have for you so that you can meet them, and for you to ask questions. For example, if you're confused about your CI's thought process, ask them, but be tactful. This is especially beneficial as hearing others' clinical reasoning can help you develop and improve your own. The final suggestion for this slide is to understand your learning style and communicate it with your CI from the beginning. This can help for more effective learning opportunities for you. For example, if you're a visual learner, it could be helpful for you to watch your supervisor perform a certain evaluation once or twice before attempting it yourself. But if you know that you're a kinesthetic learner, it may be more beneficial for you to try the evaluation yourself and get real time feedback from your supervisor to improve your learning. During fieldwork, you can save yourself a lot of stress by creating a plan for yourself, both for the overall time frame as well as a daily plan. One difficulty with fieldwork rotations, identified in a 2014 article, is a lack of structured fieldwork education plans. So, with this in mind, I encourage you to set up a time at the beginning of your fieldwork to meet with your supervisor to create a plan. Include the pacing, when you'll be taking over patients, how many you'll treat in a day, goals for when you'll start doing evaluations, things like that. Another suggestion is to try to meet weekly with your supervisor for a progress report. And I encourage you to always ask for that you can improve each week. Another difficulty students experience is planning and grading interventions. This skill was identified as the most essential technical skill for fieldwork students, but it was also identified as the most lacking technical skill. One way to combat this is to take the night before or during breaks to plan out your interventions for each patient you will be treating, and includes ways that you can adapt the activity to make it easier or more difficult. Now, obviously, it won't go exactly as planned, but going in with at least some idea of a plan will help you be more successful in the intervention as well as grading the intervention. Another important influence on your fieldwork experience is your attitude. I would encourage you to remain positive and professional throughout your entire experience. As a reminder, clinical educators require at least 1 year of experience. So don't compare yourself to your educator. This can be a fairly easy trap to fall into, but remember that the goal for fieldwork is to make you entry level. So if you're unable to do an evaluation as well as your CI with 9 or 10 years of experience, don't get down on yourself. Next, I want to say that no matter the circumstances, stay professional, as your behavior is one of the few things you have absolute control over during your fieldwork. Also, a good outlook on your situation will change your perspective, but it will also impact how others view you. This is especially true if you may be struggling with your fieldwork. If you're a professional and take constructive criticism well, you'll be viewed as teachable, making your CI want to put in the work to help you be successful. Finally, initiate your own learning. Don't just rely on your supervisor to teach you everything you need to know. Use downtime to research new interventions, practice evaluations, or whatever you need to do to make you the most successful therapist that you can be. A common difficulty that students experience during this time frame is fear of failing, which increases their anxiety. So make sure you're doing something every day to manage your stress. You can do this by exercising, meditating, deep breathing, yoga, journaling, spending time outdoors. For more information or ideas, feel free to check out my module on stress reduction. Also, take time to self reflect, as this can improve your self awareness, decision making, and competence in both your fieldwork and in your everyday life. And I want to encourage you to plan to do something fun on your weekends. Take time to see the city that you are completing your fieldwork rotation in, especially if you've never been there before. Go to museums or to the movies, or even try and find a local park to enjoy. As with all things work and school related, your time management during your fieldwork experience is crucial. Start by making a schedule and prioritizing tasks. I want to encourage you to prioritize your health during this time period. Make sure you have time to exercise, cook healthy foods, and do self care activities. And also give yourself time to decompress at the end of the day. This will give you time to reflect on what you did well and what you can improve upon for next time. Something I did during fieldwork is every night I would take the time to plan for the next day. And you can also use this time to research interventions, study for your boards, whatever you need to do school related. Finally, make sure you're managing your time at work well to ensure that you're able to treat patients and get your documentation done in a timely manner. You can do this by utilizing breaks between patients, lunch breaks, really whenever you have the time. The last tip I have for making the most of your fieldwork experience is to combat imposter syndrome. Imposter syndrome is something I personally really struggled with during fieldwork, and it's defined as feelings of self doubt and that you have fooled those around you into believing that you have the skills required to complete your job when you do not. It results in feelings of insecurity, procrastination, as well as decreased positivity, and it affects up to 70% of people. One way to combat this that worked well for me was to remind myself of all of my past accomplishments, like graduating college and getting into USA, as well as reminding myself of all the people who believed in me. I also reminded myself that professors would not have sent me on fieldwork if I wasn't ready, so I should trust their opinion. I've also included a link to a TED Talk that discusses reframing your thoughts and how that can help combat the effects of imposter syndrome. I encourage you to take a few minutes to watch this video. On this slide, you'll see a few pieces of advice to keep in mind while you're on fieldwork. First and foremost, you are a guest at the facility. And always remember that your clinical instructors are doing this because they want to and not because they have to. So it's important to treat your clinical instructor and all other therapists and staff with the highest respect. Think of this situation as if you are a long-term house guest and behave accordingly. Next, this will be the last opportunity during your program where your most important responsibility is just to learn. Absorb everything around you. I would suggest carrying around a notebook if practical, and also ask any questions that you may have. Finally, your fieldwork coordinators want you to be successful. If you're having difficulties, there's often no way for them to know unless you tell them. So reach out to them for advice or with any questions or concerns you may have. I want to end this presentation with some pieces of advice I obtained when interviewing other therapists who recently finished their fieldwork rotations. Their advice was as follows. Don't be afraid to learn from other therapists besides your supervisor. This includes those within and outside of your profession. For example, if you're an OT student, get an understanding of what PT and speech are doing and apply it to your sessions for carryover. Let's say you're working with a patient who recently had a stroke and presents with Broca's aphasia. If you know that the client is working on standing balance with PT and identification of color with the speech therapist, you can apply this for carryover while you are working on dressing. For example, you can work on dressing while standing as much as possible, and you can ask the client questions about the color of the clothing or other objects in the room. This carryover will benefit your clients in the long run. Also, if you have a hole in your schedule or a cancellation, ask if you can sit in on another therapist session or consider other professions as well, such as nursing, nutritionists, caseworkers. This will give you a better appreciation of their role in patient care. Also, work to become your own therapist, not a copy of your supervisor. It's okay if you do things differently or have a different approach to thinking about something. There's more than one way to be a good therapist. And finally, don't think of your classes separately. Think about all of the ways that they fit together. My two field rotations were in pediatrics and neuro, and you'd actually be surprised how much these two fields mirror each other. A lot of the skills we work on, like fine motor, coordination, dressing, handwriting, are all addressed in both settings. So I was able to take something that I learned about in neuro and apply it to pediatrics and vice versa. Let all of the information from all of the classes you've learned blend together in your mind and select interventions based off of the client's needs, not based on which class or setting you learned it in. So that's it for the module on how to survive your fieldwork and clinical rotations. On this slide, I've attached a link to the survey about this module. If you would please take the time to fill it out, it should only take about 3 to 5 minutes. This will allow me to improve the module and my overall program, and therefore will benefit you and your fellow students in the long run. Thank you for listening, and good luck with your fieldwork experience.